The meeting of the Mayor and Board of Aldermen for Tuesday, September the 28th. We do not have any changes to the agenda, so could I have a motion to adopt the agenda as printed?
So moved.
All in favor? Any opposed? All right, the first thing on our agenda is to discuss current COVID-19 guidelines, and so we'll start with Jimmy Allgood coming up to give us a presentation of where we are numbers-wise. In a much better place than we were a week ago, numbers-wise.
Yes. We seem to be on a downward trend for our numbers overall. You've got the new chart, and it's also on the screen.
Can I turn the microphone on?
Test.
Yeah, it's not on. Temple, come save the day.
Well, Jimmy, you see it? It's on.
Yeah, see if that one's on.
I've seen the report if you can.
Can you hear me now?
Yep,
Yeah.
Neat.
Okay.
thank you, Michael.
Okay, today, statewide, we had 1,520 new cases with 58 deaths. Locally, we have had 8,298 cases. That's an increase of from yesterday of 30 new cases. You can see on the chart our week ending for 25th of September. We're actually starting to trend down now, average of 22.86 cases per day over the past 7-day average.
All right, and our hospital numbers continue to be much better. I looked, we get a report each day of how many people are in the hospital and how many are in ICU that are COVID positive. And that number has gone down dramatically over the past few weeks, but consistently over the past 7 days. And one thing that I think is interesting to know is the hospital takes direct admits or transfers, which is based upon how many open beds they have at that time. And they have taken in 31 direct admits or transfers over the past week, which says that we're doing a good job of freeing up hospital beds, so they are able to take folks from surrounding counties or states even when our beds become free. And it shows what a great job our hospital has done in managing effective care when they are a regional health center. So we certainly can't thank our hospital staff, physicians, nurses enough for all of the hard work that has gone into managing a patient load that includes people from several different states in our community.
And I've got today's numbers on the hospital that you sent out. We have a total of 27 COVID patients in the hospital, 9 of these being in the ICU, and there was only 1 direct admit and transfer last night, and that was somebody from Mississippi.
So it just shows that the number of cases that are having to be hospitalized are going down, and I hope that means it's because more people are getting vaccinated. Vaccinations are keeping people out of the hospital. We continue to hear from our hospital administrator that more than 97 to 98% of folks that are hospitalized with COVID are unvaccinated. So with that information, board, does anybody have a question for Jimmy? Thank you, Jimmy. All right, any discussion or questions or suggestions from the board?
When I made the motion, however many weeks ago it was, we were on our track moving up. Our hospital's in my mind, dire straits. With our hospital now doing well.
Rick, will you move that microphone to your mouth? I'm sorry. John Morgan can't hear you.
Now? You got it, John?
Yeah.
There you go. Starting back over. With our track of numbers going up, when I made the motion to go to a masking mandate and our hospital in dire straits, in my mind, and they asked us to go there, with our numbers completely coming down, only 1 direct transmit. I think we had at one day, a couple of weeks ago, there were 17 in one day. I mean, it was just huge. But our numbers have come down dramatically. I'm good with our local numbers are very good. I make the motion to remove the mask mandate, going back to where we were whatever day this was that we made our first move. So that would leave our unvaccinated employees inside city buildings still with masks.
Okay, so your motion is to remove the mask mandate community-wide, taking a
Yes.
step back to where we were last, I guess, with city employees and city buildings who are
Correct.
unvaccinated wearing a mask. Am I right?
Correct.
Second.
All right, and a second by Bailey. Any discussion or questions, comments? All right, those in favor signify by saying aye.
Aye.
Any opposed? Any opposed? All right, thank you, the motion passes. Next, Chief McCutcheon, if you'd come up, we have consider a permit for Lafayette High School Homecoming Parade.
Thank you, Mayor. We received this. They're requesting to do a parade from Buddy's Parkway at the new elementary school straight forward to the Lafayette High School on Thursday afternoon at 6:30.
Excellent, excellent choice of where they're going and where they're ending up. I think it's a great choice, and I make that motion to approve.
Second.
All in favor?
Aye.
Any opposed? All right, thank you. Is Braxton here? Yeah, there you go on the back row, sorry, got my reader zone, I couldn't see to the back row. Braxton's coming forward to request permission to approve unpaid volunteers to run animal transports for the Oxford Animal Resource Center. They have been, certainly, people have been generous with their time and offering to drive animals for transport, so Braxton?
This is Ann and Walker Brown, and as she said, unpaid volunteers for transport.
Motion to approve.
Second.
All in favor?
Aye.
Any opposed? All right, Rihanna. Rihanna is here to request permission to advertise for bids on the Cemetery Creek project.
Yes, this is our project we've been working on for a number of years, and we received the hazard mitigation grant funding this year. So we are ready to advertise and want to request permission. And this project is budgeted in our current fiscal year. There are funds available.
So moved.
Second.
All in favor?
Aye.
Any opposed? Thank you. I would now ask the board to consider an executive session.
Move and consider executive session. Second.
All in favor?
Aye.
Any opposed? All right, the board will now consider an executive session.